everybody, welcome. Welcome to the campaign call for December, last one for the year.
We also have our QR code that you can scan on the screen if you want to take our campaign pledge. And then also at the end of the call, Tori will give you some ways that you can take action. And then also if you scan the QR code, it will also give you some options there.
Hey, great. Thank you all so much for stopping by and being part of the Public Health is Public Safety campaign. This is our last webinar for the year. We've done some amazing ones. We've talked about overdose in Indigenous communities. We've talked about the spectrum of recovery, the war on drugs, the history of how we got here. All of those different webinars and short videos you can also access on our YouTube page if you ever want to go get caught up. So on YouTube, it's dream.org. But starting the webinar, I really wanted to get folks excited about what we have coming up. I know right now, maybe some people can be feeling some kind of way. I know I do every day. And no matter what party is in position, who's elected, it doesn't really matter. History shows that usually on criminal justice issues of substance use, we haven't had many champions for us either way. So we have to be our own champions and learn how to fight for those causes and fight for those that we love. So this year will be the first year of the Public Health is Public Safety campaign. We launch in the fall, but in January, that's when legislative sessions get up and going, and we really would love your involvement. So we'll be working in Kentucky, Arkansas, New Mexico, Arizona, Wisconsin. We'll also be talking about in the future our new health and justice advocates. So we're going to be doing a lot of community building and organizing in Mississippi, Missouri, and Oregon, and more states to come. So please join the campaign. If you live in any of those states, figure out how to get involved. But even if you don't live in those states, we are going to be working on a lot of federal initiatives that will affect every one of us, no matter where you live. So I'll get into that a little more later. And also, we're going to have a bunch of new trainings for this year. So if you haven't signed up already to volunteer and be part of the campaign, you definitely want to do that and really be able to utilize those trainings and strengthen your skills. But now I want to talk about what we are all doing here on this Thursday, a week before the holidays. We're here to talk about something really, really important. So this month is Human Rights Month. And sometimes when we have those conversations, folks that are incarcerated or have been incarcerated are left out. So my dear friend here, Marsha, with really, Ray having her back, is actually who brought this issue and said, hey, we should really do a webinar, some education. We need to talk about more about people that are overdosing while incarcerated and overdosing when they're trying to come home from their communities, how the criminal justice system doesn't help folks. How we'll talk about later, we're seeing stats that it's even more deadly to folks who are trying to be in recovery or folks who use drugs. So overdose at this point is one of the leading causes of death among incarcerated individuals and those recently released from jails and prisons. The lack of access to evidence-based treatment, including medications for opioid use disorder during incarceration, leaves many untreated, increasing their vulnerability to fatal overdose. Upon reentry, individuals face a heightened risk due to reduced tolerance and limited access to medical care, housing, and support services. Addressing this crisis requires immediate action. Unfortunately, overdose rates amongst Black, Indigenous, and Latinx communities are rapidly increasing. And people that are recently incarcerated upon reentry are 27 times more likely to die from a fatal overdose 2 weeks after being released. From 2001 to 2018, and I'm even scared to see what this stat looks like now, but the rate of overdose deaths in state prisons increased by more than 600%. Y'all, the people that we love are dying. Lack of adequate health care and drug treatment within prisons contributes to these rising death rates. Most incarcerated people don't have access to health, mental health resources and or treatment. So, as I mentioned, when Marsha said, why aren't we doing a webinar about this? Guess what? We put together a webinar about this. So tonight we're going to talk about what's going on for folks while incarcerated and overdose rates rising, what's happening when folks try to reenter, and then later we're going to talk about solutions. Please, during the webinar, if you have any questions, like Tori said, put them in the chat. But now I'm going to kick it over to the star of tonight's shows and folks who I truly admire. So Marsha.
Thank you so much, Amanda, and thank you to Dream. And I'm so glad to see all the familiar faces. So we're going to get right to it. My name is Marsha King. I am the CEO and founder of 13 Liberation Village, and we focus on assisting those that are affected by the criminal systems, whether it's during pretrial, trial, sentencing, and thereafter if someone is convicted. I'm not a person that have experienced any issues with addiction, but it really became close to my heart when I served my own sentence of 5 years in federal prison. I noticed when I first came to prison, 2015 to 2000 to late 2018, it seemed like I was just away for school. And then out of the blue, I started seeing some of the ladies at Alderson experiencing side effects from this drug I had never heard of. And they would hit their head against the wall, fall out, hallucinate, vomit, just different things that I had never experienced or seen. And I'm like, so what happened for us to all of a sudden start having all these women experiencing these side effects? And I was told it's this new drug. It's called Spice. And a lot of people take it because it's undetected when you take the drug test. So once I was released, I started working back into Tennessee state prisons. And I noticed that Spice and other drugs, that the men start overdosing at a higher rate than I've ever seen before. I mean, the state of Tennessee, especially in the CCA prisons, you had men that were dying, almost 3 or 4 men were dying per week, and the prison didn't know why. So then it became my mission to ask, okay, start putting these men on the phone. I want to know what's going on to make these men feel that they have to start taking drugs, whether it's to deal with the environment, is it to deal with the sentence? As I started talking to these men, most of them started telling me how it was the fact that they weren't getting any help for mental health issues that they've always experienced. So they started taking drugs to deal with the mental health issues. And then you also had those that already had some type of addiction, and that addiction was not addressed during the pretrial phase. And then as a result, now that they're incarcerated, there's no available programs if you have a certain amount of time. And I noticed in talking to them, most of them said that really all they wanted was somebody to listen. And if you listen, then you can come in to give us help. So I noticed that there's no programs that's created. So what I started doing was telling them, what is it that you all can do to create a community yourself, and what it is that you can do to help deal with these addiction issues. One of the many things that they started doing is just simple things like creating healing circles where people are able to come in and just be able to talk about their issues. And then I was able to start calling down to the prison and encouraging the facilities to create more programs than at just one facility where all the men would go to get that assistance. So I think that the addiction issues in incarcerated during incarceration is something that sometimes when we get out, that we forget that they're still there suffering. And what is it that they need that can actually help them to overcome this, so when they're released, they're not having the same issue. So one thing that I noticed when even speaking with someone today, the first word that they brought up was restorative justice. And that person was telling me restorative justice is something that they would like to hear more about, because with restorative justice, it can also help address these issues mostly, and I say mostly the state level, because I was incarcerated in federal prison. And one thing that I can say in regards to federal prison during pre-trial, one of their number one priorities is they ask if there's any type of addiction issue. So if there's an addiction issue, that is primarily addressed from the time that you walk into federal prison and placing you into some type of either mental health program to seek counseling, or whether a methadone program or RDAP or just a 90-day drug program, which is something that I think that if the state prisons actually use, then they may have some of the same success rates as the federal prison. Not saying that the federal prison doesn't experience any issues, but overall, I can say from being in federal prison myself that I was able to see that there's more access to resources in federal prison than in state prison. And I'm going to go ahead and pass it on to Ray to talk about reentry.
Good evening, everybody. My name is Ray Mendoza. I'm from Milwaukee, Wisconsin, with an organization called Free. We do a lot of reentry work for women coming out of the system, whether it's state or federal, it doesn't matter. We work with women that's working, coming into reentry. As far as within reentry and the drug use and abuse that's going on, you got to understand, right? They don't give you the treatment that you need inside the prison. So if you don't get the treatment that you need inside the prison, you coming outside, you're not getting that out here, because out here you got to pay out of pocket. You don't got no insurance when you first come home, so you're stuck between a rock and a hard place, because you don't have the insurance and you don't have anybody that's pushing you to get the help that you need to get off of the drugs that you're on. It's hard to get off of the drugs inside of the penitentiary because the drugs are so prevalent inside. So if you're still using the inside, when you come out, you got more access to it out here. It's easier access and it's a lot cheaper than it is in the penitentiary. So when you come home, it's easier for people to get a hold of it. It's easier to stay addicted. It's easier to end up in the hospital or whatever the case may be. So we got to figure a way to get to get the rehabilitation that people need, or get the support that people need. We got circles of support. They go on all over the city of Milwaukee. We got programs that are ran and uh, are being addressed by formerly incarcerated people that know what it's like, or formerly addicted and incarcerated people that know what it's like to go through this struggle. And so there's a lot of support out here because people have been through it. And now people are starting to understand that if you don't get the experts in that situation to help people get out of that situation, you're never going to be successful with it. It takes people to know where you've been to get you out of where you've been and put you somewhere else. And so that's what we're trying to do here, is to get people to understand that there's a way to get out of that, and there's support out here. And so we try to address that. And so everything that we do is for the people that are suffering the way we have suffered, or the way that things have been going on for who knows how long, right? And so what the goal here is to get in with Dream so that we can get in and change these federal laws so that people can get the help that they need out here federally or legally, constitutionally, because we got that coming. They just don't want to give it to us. The only way we can give it to the only people that can advocate for you better, they're the best person to advocate for you and your issue is you. I can say everything I want about Marsha, but if Marsha doesn't speak up for Marsha, Marsha ain't got nothing coming. So if none of you guys talk about what's going on in your community, in your city, in your state, in your county, in your rural area, or in your urban area, if you're not talking about it to the legislators, they don't know about it. The legislators are not going to ask their normal constituents that they talk to all the time about what's going on in the community. They need to hear from the resident experts, from the people that are dealing with it every single day. And that's us, formerly incarcerated men and women of color. And now more than ever, women of color. And we need to support them and get them to support themselves to get this thing right. Because nobody else, Amanda said it perfectly. It don't matter what side of the aisle it's on. If it's talking about drug reform, if it's talking about criminal reform, if it's talking about anything reform that's going to help us, they don't care about it. They don't care. We have to be the ones that care. We got to show them that we got people that are with us, that are the people that you like talking to, but they're on our team now. So now we got to persuade them a whole nother way. So we got to use their people to get them to get what we need to get done in our communities. So this is the whole purpose for all of this stuff, man. We need to understand that we have problems that need to be addressed. And the only people that can get them problems addressed are the people that's going through the problems. And if you're on this webinar, you either are part of the problem, meaning you're living that problem, or you're very close to someone who has that problem. And the only way to advocate for them is for you to say something and to get them to say something for themselves. So, man, let's get this, scan that barcode and let's get it. Let's get this work done, man, because this is what we got to do. We got a long fight ahead of us. These next 4 years are going to be long and drawn out. But guess what? If you like fighting like I like fighting, then you welcome this challenge. So let's get this money. Let's get everything right, y'all. Let's get our people right.
And
Right.
just
Thank you. Go ahead, Marsha. Sorry.
And just to piggyback off Ray, and I apologize. I was trying so hard. I was getting so passionate about it. I was like, I just want to make sure I didn't go too long. So I apologize. But just to piggyback off Ray, what he's saying, even those that are mostly in state prisons, and I'm emphasizing so much when it comes to the state prisons, because I just think they are such at a grave disadvantage when it comes to advocating for themselves and families advocating for them, and even those out here advocating. One thing that I notice is most people that do federal time, we come out running. We're either creating a nonprofit organization on what it is that we're passionate about, we're doing policy work, but it's not as at a higher rate for the state as it is for the feds. And I think it is because of the lack of resources. So if we don't go back into the prisons and be able to advocate for those that are incarcerated and to actually voice that these men and women are dying at such a high rate and nobody hears anything about it, we don't know what to push for policy in regards to these state prison, or to push for some of the same programs like RDAP, not just at one prison in West Tennessee, but RDAP, a program similar, should be at all the prisons, because all the prisons have a very high rate. Almost 80% of people that are in prison now are in some way addicted to drugs. And these are some of the same people that came in with no addiction, just trauma. So as a result of dealing with that trauma, they created some type of addiction issue. So I just wanted to piggyback on Ray as far as speaking up and advocating and really being a voice for those, even if you don't. I've never had an experience. I grew up in the church. I didn't see many people with that had addiction issues. So when I went to prison, and I'm seeing people that I just had a conversation with and are suffering, or telling me how they suffer from addictions and what happened, that was mind blowing to me. So I wanted to know, well, what can I do to be a help, to benefit, to help you benefit from this time, so this is something that you never have to experience. And then even once I was released, I lost my bunkie, Stella. Stella was my bunkie for my first 2 years of my incarceration, and she passed away. And then I had others thereafter that I knew at Alderson that passed away, that had something to do with their addiction issues. So it affected me. And that's why I push so hard, as far as, let's go back to the prisons and make sure that we don't forget them and forget to fight for whatever resources and be that voice that they need.
Thank you.
I'm sorry, go ahead, Amanda.
No, no, I keep thinking you're done. Absolutely not.
I'm done.
So that was amazing. Now I want to get into solutions, but before we go to Q&A, I actually have a question for Marsha and Ray. But now I want to talk to solutions. So just what Ray and Marsha talked about, you getting involved, being connected with dream.org, the Public Health is Public Safety campaign, using your voice. What are some solutions that we're working on? Because we're not just about talking about the problem. We're really trying to find ways to solve it. I mean, anything from making sure that jails and prisons have Narcan in the cells, not the officers, but people in those cells need to have it. Looking at how do we make sure we expand MOUD for folks who are incarcerated. And my amazing colleague, Jay, works so hard on expanding it even outside of incarceration. You know, there was a study, y'all, in Australia that showed that people on methadone or Suboxone had a 94% lower risk of overdose in the first 4 weeks of leaving jail or prison. But unfortunately, so many of our jails, prisons doesn't even allow MOUD. So there's so many different solutions, expanding mental health care, you know, diversions and alternatives to incarceration, like Marsha said. But I want to specifically talk about some things that we will actively be working on in 2025. And we really need your help. So something that's really, I think, has the potential to really help save lives is the 1115 reentry waiver. So back in the day, in federal law, there was something called an inmate exclusion policy. And what this did is it prevented incarcerated people from receiving most healthcare services covered under Medicaid. So we see what has happened. You all know the medical services for people incarcerated are, I mean, I don't even know the word for them, atrocious. But so this left people without the necessary health care they needed, mental health care, and during reentry, it was another huge hurdle to try to find health care while you're you know, trying to build your life and get into society and not go back to jail or prison, because probation and parole is so hard to walk. But back in 2018, the Support Act, it was a federal law passed, and it actually laid the groundwork for changes, encouraging states to provide pre-release services with Medicaid to eligible people living prison. So, interestingly enough, that bill was signed under Trump. So then the Biden administration, so that kicked the door down some. And then in 2023, CMS, the folks on the federal level over Medicaid, allowed states to start actually applying for these waivers and really made the framework. So that gives me a lot of hope that this can be a nonpartisan issue. So at this point, there has been states around the nation that have applied for these 1115 reentry waivers. States can provide Medicaid to folks who are eligible 90 days before release. That can include things like MOUD, so medications. That can include mental health counseling, case management for when people are reentering, to be able to have that warm handoff. It can, include a spectrum of different healthcare that people so desperately need. So as I mentioned, a lot of states have already applied, but not all. And even the states that have applied, we have to, as directly impacted people, have to make sure this is implemented. I am a person in recovery who loves harm reduction. But when I was incarcerated, I remember detoxing on a cold concrete floor. I had an abscess on my arm. They thought I had some type of blood disease. My fever was 103. I was hallucinating. I'd just been taken away from my children and was like hallucinating that my baby was crying. It was horrible. I thought I was going to die in that jail cell. And still, a lot of folks, that's what it looks like for them. So these reentry waivers and starting to build that better system of care of reentry is so, so important. So please join us to push for this in your state. If we're already working in your state and you have one, how do we make sure formerly incarcerated people are involved in it and making sure it's the best waiver possible? We need to be the watchdogs, making sure this really happens. Also, we'll be working on in some states what's called a HRSN waiver. So this also provides temporary support for people when it comes to housing or transportation, when they're leaving jails and prisons, and even people in the community. So please join us for your state or other states to help us fight for those. We're also going to be working on some federal bills. So one bill that we're going to be working on is called the Reentry Act. And this bill just means that 30 days before leaving jail or prison, an individual receives Medicaid at that time. That way, the medications that they need to be on, that case management I mentioned, peer support, all of that can start. Obviously, I would want it to be longer, but this would be a huge step for us. And to make that unified in correction systems is huge. So this year, there was a bunch of momentum behind it. It was HR 2400 and Senate Bill 1165. Huge bipartisan support, something very interesting. JD Vance was actually a co-sponsor. A bunch of our Dem friends, folks on the other side of the aisle. So that's something we can't just let die. Like that's something we can really push, and I think we can get done. Another bill is called the Continuity of Care Act, and it's all about allowing folks who are incarcerated not to lose their Medicaid. So if you are in their pretrial, and we see in populations, that's when people are most likely to really suffer from healthcare. Well, unless you have very long sentences. But, often you get incarcerated, as I mentioned, people detoxing or being taken off their medication. This would be huge. We want people to get out. We want them to be healthy. And then we'll also continue to work on the Restore Act. Because when we look at reentry and making people whole, one thing that everyone should have an opportunity and be treated as a human. Unfortunately, right now, people can be denied SNAP benefits if they have a felony drug conviction. every state has an opportunity to get rid of this on the state level, and some states have. But a state like South Carolina, if you have a drug conviction, you could never get SNAP. And imagine a mother trying to provide for her children and trying to get on her feet after incarceration, how this even affects families. So those are 3 bills. We have a lot more. I just want to like tease it with you all. And if this is things that you're like, yes, I want to do that, and those waivers, please come join us. If you all been to these webinar, you know, we have a whole other slate of a bunch of great initiatives and bills to work on. So please join that campaign. But before I drop another little tool for you all and tell you what it's about, I did want to, while Marsha and Ray was talking, I wanted them, because we're asking people to get involved, right? And that might seem overwhelming. Like, what does that even mean? I would love for you all to tell small stories about ways that you've got involved. And Ray, I particularly think about your work on the Equal Act. So I would love if you talked about that. And then Marsha, I would love for you to talk about something that you have worked on in the advocacy space.
You want me to go first?
I do.
Okay, so how I got involved, this goes all the way back to when I first got out. I was in a halfway house, and a guy that I knew way back in the days had asked me if I wanted to volunteer with him to do a neighborhood cleanup. And so I went out there, and he happened to tell him,
You had cut out for a minute, but you're back.
okay. So when people heard the story between me and him, they started reaching out to me to come talk about different things and get involved with violence prevention stuff and things of that in the community because of my history in the city. And so I got a 20-year sentence in the feds. I did 17 years and 9 months in the feds. And so when I went in, it was some gang related stuff that and I'm pretty well known in the city. And so when I came home, like, people found out that I was doing stuff in the community. I got, I guess, drafted to work a program called 414 Life, which was a violence interruption program. And I helped them. I did a lot of that stuff. And so I ended up bumping into a guy that did some state time that was involved with Dream. He was working with Dream. And he said in about a year, we're putting together a federal advisory committee to work on to do some lobbying and work on different things to help on the federal level. He said, I want you to get involved since you did federal time. And I said, all right, cool. I just said it and blew it off because I didn't think anything was going to come of it. And so about a year later, he reached out to me again. He seen me again. He said, hey, man, you ready? I need your email. So I gave him my email. I still didn't think nothing was coming. Then I get an email for his link to get on the Zoom call. And I'm on a Zoom call with like 12 other people that did federal time. And they're talking about this thing called the Equal Act. And the Equal Act says, we want you to take the 1994 crime bill, the crack law, just the crack law, bring the ratio from, which right now is, well, at the time it was 18-1, bring it from 18-1 down to 1-1, which is crack and cocaine. So if you don't know what the crack law is, if you get caught with a kilo of crack cocaine back in 94, you got sentenced at 100 keys of powder cocaine. The ratio was 100-1. Obama came and made it 80-1. And then again after that, he made it 18-1, and it stayed there. So now what we're saying is we want the Equal Act to pass. We want you to make it 1-1, but make it retroactive to 1994, so that everybody that's doing life right now for a half a key of crack cocaine or for an ounce of cocaine, because they had a bad record, they got a life sentence. We want them to come home now. And so right now we have some support, but we need more. And so they were trying to put the fentanyl in. They wanted to give us the crack, but they wanted to raise up the sentencing factors of fentanyl, and we're not going. We're not going for that. You're not going to take a drug that's proportionally disparaging in different communities and add more time to it because this specific community is using it more than the other one, and do what they did with that community with crack. We're not allowing that. So our fight right now is just give us what we want with the crack. That's it. We'll talk about fentanyl later. That's another fight we're going to have to take on. But right now, we want crack to be 1-to-1, retroactive, and let these people out of prison. You saying that you don't have no room? Let me show you how not to build any more prisons. Let's get people out of prison. You got all these people that you so-called got to deport. Well, why are they doing time? Get them out. If you say they already been deported, send them where they got to go. They come back, you know what to do with them. Get these people out on this crack law, get them out, clear their bed space up. Simple. It's simple mathematics. We just got to teach them the math. I don't know what they're doing, but they're not doing simple mathematics. Theirs is complicated, and we don't understand it, but they don't understand it either. So we need to get them back to the simple mathematics and get our people out of prison. That's it. That's all.
Thank you, Ray. Yeah, and next year we'll be fighting for the Equal Act, y'all. And we need more folks to meet with their Congress people, help get it over the line. Marsha, if you want to talk about something that you've done with Dream, like advocacy, yeah.
So when I first was released from prison, I thought I knew everything about advocacy because I advocated in prison. And when I was released, I started meeting a lot of different people online. I had done this talk about the compassionate release and met this young lady that knew Ms. Ruby. So she was like, this lady, she passes all these bills, and she can really kind of help you sharpen your advocacy better. So I reached out to her and I said, hey, I told her who told me about her. And she said, well, what would you like me to do? I said, I want you to teach me everything on how to be a better advocate and to understand certain things I don't understand, because I do understand federal law, but I don't think I understand everything about advocacy. So for a year, she would send me questions and ask me different questions about different federal laws. And then I end up getting an interview for an internship. And the internship that I had with Dream was kind of life-changing because it introduced me to not only understanding advocacy and creating training, but also understanding policy work, which policy work goes hand in hand with understanding federal law. As a result of going through the internship and then the cohort, I just fell in love with policy work, and I ended up going with Dream to DC to lobby when Senator Marsha Blackburn, which was trying to return those that were on home confinement back to prison. So just sitting in those offices with Candia and with Sean, actually speaking to the different senators and Congressman Don Scott was just life-changing for me. How they just gave me so much information and was so encouraging as far as, because of my experience, you have nothing to be ashamed of. You're just like the expert to let them know that people not returning back to prison would be beneficial. And as a result of that lobbying, a lot of people didn't return back to prison, and now they've received commutation for the sentencing. So I've enjoyed every step of the way working with Dream. I'm on the Federal Advisory Council. We meet once a month, and just the awesome work that Dream does just with harm reduction, with the drug policies that I've already told you, Amanda, that I would love to work on next year. It's just something that's just been life-changing for me. And I can honestly say that you all really do the work. You all were my first job when I was released from prison. I couldn't find a job. So as a result of my start here, that opened the door to me also being able to get other jobs. I was able to be vice president of an organization because I was able to list the training and the internship from Dream, and also the learning of policy work and lobbying. That has been so instrumental in opening other additional doors. Now that I'm working on a state level in Virginia, I just mentioned Dream and how I this webinar, and that opened a door to being on a policy education committee here in Virginia, and other opportunities, community partners and everything. Because, you know, everybody knows that the training that you get here during the cohort and just the regular training is really good training that you'll be able to go out and use. So it's I can say that you all have fed into me even after I left. If I had never met Miss Ruby, I thought I knew everything, and I never. That's one thing I always give you guys, Miss Ruby. You all have been so beneficial to getting me where that I need to be, and I'm just so grateful for the work that you all do and will continue to do. So my experience has been awesome. It's been excellent, and I look forward to working with you all in the future.
Thank you, Ray and Marsha. You all are so inspirational. And like Marsha said, 1,500, 1,500, 1,300. Yeah, people were just commuted, and so many of those folks were people on the CARES Act that Marsha Ray got to fight for. And even though the Equal Act didn't pass, the DOJ did make a rule that going forward, they would sentence 1-to-1. We're still not done, but it just shows you your voices, your advocacy makes a difference. So we really want you to join us in this campaign with superstars like Ray and Marsha. I did want to give you all a resource. Sorry, we're a minute over. Tori's going to get me so we can get to Q&A. But one of our partners that we work with on some drug policy stuff, Vital Strategies, just recently put out this amazing resource. Did you all know that there is $49.7 billion for communities to use to help rebuild because of opioids? So every state and local government, you all, has this money. So no matter where you are, there's a way to advocate, to fight for this money, to have it used for good nonprofits, to uplift incarcerated and formerly incarcerated voices. In the chat, Tori has put an amazing guide. It is state by state, what it looks like in your states, how you go about it. We will be working on some opioid settlements in some of our states, but if this is something you are very interested in working in, let us know. Our team over at Public Health is Public Safety has grown. Miss Jay Garcia is officially on the team now, Mr. John Bowman and Matt. So we have your all's back. But this resource, we're never going to hog resources. We're always going to pump them out when we get good ones to you all. So yeah, please contact us. And now I'm going to turn it over for Q&A.
All right, Marsha, I'm going to spotlight you to lead the Q&A section, but I'll spotlight if anyone else wants to contribute to the answer. But the first question is from Audrey. It is, how do you start a campaign to get state prisons to address addiction? Is there a state with this action? And once again, this could be for anybody, but if you want to give your thoughts first, Marsha, we could pass it off to anyone else.
How to start a campaign. Usually, whenever I start a campaign, the first thing I always do is I simply go back to the basics. The organizations, that's one thing I like about Dream. They always emphasize on coalition, having other organizations to help support. So I always start with building my coalition with organizations of like minds, and then creating what the mission is collectively for all of us. So it's as simple for me as starting there. I haven't directly, Audrey, worked on a campaign dealing with drugs, but mostly the campaigns that I work on are dealing with prison conditions. But I think, in my opinion, when it comes to a campaign, it's pretty much all the same. But I start first with creating a coalition, then creating what the mission and the goals are, and then uh, putting individuals in their prospective places. What would be a strong point as far as who would be the manager, who would keep certain records or anything else additional in regards to the campaign, and then focus on funding to also fund the campaign as well. Ray?
Man, nothing else I can say. You said it all. You gotta have a strong coalition. You gotta have people that are gonna fight the way you're gonna fight. You gotta have people on the same page. If you make a left when you're supposed to be making a right, you're gonna crash every time. You guys got to be on the same page. You got to have the like-minded people with the same, preferably with the same experiences, with the same mindset, with the same drive and the same fight within them as you, because nobody else is. This isn't important to nobody but those that it affected. And so, if it affected you, you have to be effective in your argument and your fight about whatever it is that you want to fight about. But you got to build a strong coalition, and that's not just people that you know. That's people that you don't know, that you need to get to know, because they have strengths that you may be weak in, and they may be weak where your strength is. And so you got to build off each other so that you can attack this in the proper way, so that people can understand the validity in what you're saying, the sincerity in how you're saying it, and the seriousness of the issue and how the change needs to come about. So for me, the main focus is coalition building. Without a coalition, you got nothing.
I mean, plus to everything Marsha and Ray said. Yeah. So that coalition is huge. And then, like Marsha said, and Ray, once you have them together, then really looking at your goals, and then you can see to where you need to go. Does it need to concentrate on a jail, a prison? Are you trying to do it for your state? Does your state have one of these 1115 waivers, something that's already moving that you can get involved in and expand? But without that coalition, it's not going to work, because you got to think, y'all, like there's coalitions everywhere, like the jailers, the correctional offices, the judges, sometimes they're all in coalition. So and being able to have access to them, um some battles are very hard fought. Some things people are like, I've never thought about that, or I'm willing to do that. We need support from the community. And also our team, if there is a campaign that you're working on and you need help, you can contact our team. I'll put my email in the chat. And like I said, we're a small team, but we are mighty. And we're able to work with you and help you learn how to do a campaign, help you support that campaign. That is huge, huge to us. And great, Marsha put her email too. Marsha worked with a campaign team forever, so she knows what it's all about, Ray. So yeah, we're all here to support you.
And it's nothing like getting nationwide support. It's nothing like getting nationwide support. When we went to DC and we had somebody from Missouri, Kansas, California, Wisconsin, New York, we got people from all over the country, from right there in DC, talking to the people in DC about what we need in our respective states. There's nothing more powerful than that. When you got a coalition of people from across the country together coming to Virginia to talk about what's going on in Virginia and the type of change needs there, or we're going to Iowa to talk about the changes needed in Iowa, or we come to Wisconsin and we talk about the change we need in Wisconsin. But you got people from all over the country. I got on a video and talked about the need to not open up a prison in Kentucky all the way from Wisconsin. No, we don't need no more prisons. Stop that. You're wasting money. Let's put it somewhere else. That's when you get people from all over the country talking about this one little spot in the entire nation. Then they look at it differently. Like, oh, wait a minute, they got a lot of support. We need to rethink this, and that's the attitude we want them to have. We want them to start saying we need to rethink this stuff because these people are really getting angry with us, and they pay our bills. And that's the bottom line right there. We pay their bills. So if they're not doing what we want them to do, we need to stop paying their bills and pay somebody else's bills. That's all I got.
Thank you guys for the amazing answers. We have one more question. Feel free. We might have like enough time for one more question if you have any. But this one's for you, Amanda, I believe. I think it's in reference to some of the bills that you mentioned. Are these bills and acts at a state or federal level? And are they aimed at prisons or jails or prisons only?
Yeah, no, that's a great question. So the 1115 waivers, those are on the state level, and any state can apply for those. So that's any and all states. And depending on how you apply for that waiver and write it, it can be for prisons and jails. That's always the gold standard. You know, we want to make sure that we don't leave folks behind. And then those bills that I talked about when it came to the Restore Act, the Reentry Act, the Due Process Continuity of Care Act, those are federal bills, but when they're implemented at the federal level, they will affect states. But those all would be bills that we will be working on, and the Equal Act, of course, at the federal level.
Perfect. So then last question from, I believe it's Mariah. How can folks support your work in securing 1115 waivers, and in which states? Do you have priority states? But I dropped the question in the chat because I believe you, Amanda, or some of the folks in the chat can contribute on how she can get part of the conversation.
Yeah, so we do have priority states, and I want to let Marsha and Ray in with last words too, or whatever. But we do have priority states: Kentucky, Wisconsin, Arizona, Arkansas, New Mexico. We are actively working on the 1115 waiver in Kentucky. It's already been approved. We're pushing for the best practice implementation, and also pushing, I love it, Mariah, and also pushing to expand it. So please hit us up if you're interested in that. And also, Jay and her crew are working on it in Arizona, another one of our priority states, and we want to keep expanding. But even if you're not in one of those priority states and you want to work on it, hit us up. We will support any way that we can. We are a small team, like I said, but still we will give you some kind of support that will be very meaningful and helpful.
Oh, perfect. Marsha, Ray, do you guys want to give any final thoughts?
I guess I'll go first since ladies first, right, Ray? But as the last words, I feel like everything in life happens for a reason. And what I thought was one of the worst times in my life, when I was sentenced to 100 months in federal prison, has actually been instrumental in, number one, helping me to understand how important it is to partnership with organizations like Dream that really does go out and do the work. In prison, I'll never forget sitting waiting on the First Step Act to be passed, because I had left my daughter exactly 1 week after she turned 1. So I just remember everyone saying, you're not going to do the whole sentence. So I just remember my first 2 years just always going to Court Links checking to see if that First Step Act had actually passed, till it finally passed under Trump's when he became president. So as my last words, I just want to emphasize to those that are watching to make sure that when you get those emails, because I get those emails too about supporting and donating, to know that somehow these organizations has to maintain. And sometimes we feel like, because at that moment we're not directly impacted, that you just skip over these emails. But I can honestly tell you, as someone that's been impacted, we need these organizations, because I'll never forget that Dream was one of the first organizations that was actually pushing for the First Step Act, and was so excited when it passed, and then we was able to take advantage of it. I am a recipient of the First Step Act. I was released early under the First Step Act, and then it was just ironic. My first job was with Dream. So everything that has happened since my release, of being released under the First Step Act has actually been just what Dream named it. It has been a dream, because they have been so instrumental on really helping me to go back and support those that are still sometimes forgotten and don't really have that voice. So I just want to admonish you all, when you all get those emails, to really donate. It doesn't matter if it's $5. This is not something they asked me to do. I just now understand, after going through what I've been through, how important it is to have the support of you all and really pushing, so that these organizations can still be behind, be here, and be there as a support for those that are incarcerated. And thank you all for the opportunity of being here, and thank you that I was able to share with you all, and I'll pass it on to Ray.
Yeah, I want to thank everybody for your attention, for your time. Also, let me just say this, man. Listen, nobody is gonna fight for you the way you're gonna fight for you. If you don't speak up for yourself, don't get mad when nobody else doesn't speak up for you, because that's why they gave you a mouth. You have to speak up for yourself. Stand up for yourself. We fight for those who can't fight for themselves, but we also got to show and teach everybody how to fight for themselves. There's a method, right? And once you understand that method, it's simple. All the nervousness, all the butterflies, all that stuff that people say, oh, I don't like talking to. I'm not trying to hear all that. If you care about what's going on in your community, if you care about what's happening to your little brother or your little sister, or what happened to your mother, or what happened to your auntie, or what happened to your wife or your husband or your boyfriend, whatever the case is, then stand up and fight for it. We've been fighting for years and we're not getting what we need. So now we need these younger generations to get busy, because us older people, we getting old now. We can't fight as like we used to. And when we was that young, our fight was different. We was the ones that that they was wanted to fight against, because we doing all that dumb stuff to get to where we ended up going. So it's time for us to start changing the mindset of our communities and start making sure that we understand that we need to fix what's broken before we can address anything else. We got too many things that's been broken in our communities. We got to fix our people before we can fix anything else. And in order to fix our people, we need to change them laws, because them laws are what's hurting us right now. So start standing up for you and your community, and whatever issues you want to talk about, let's fight. I'm with you. I don't give a damn who you want to fight. Let's go. If we changing law, let's change law. I don't give a damn who it is. What state, what country, let's go. Let's fight. That's me. Let's get it.
I think we're all cheesing right now, right? With love and drive. All right, thank you guys. I know we're coming to the end of the webinar. Ask if you could just stay a few more minutes longer. Jay, if you could share the slides again. I got just ways for you to get involved, and then you're good to go and spend the rest of your Thursday evening. If you are not already signed up to join our campaign and have taken the Public Health as Public Safety Pledge, you can scan this QR code or use this link right here. This is a way to sign up and get directly involved in the work that we've already been doing and will continue to do in 2025 for this campaign. So please, even if you're not sure if you've already signed the pledge, go ahead and sign it again. I think it's the same as the last call. So if you signed it last time, Gabby, then you're probably good, but it doesn't hurt just to do it again. All right, next slide, please. All right. Oop. And so one of the bills that we're going to be working on, and Amanda mentioned, is the Restore Act to restore SNAP benefits for those who have been convicted of a drug conviction, no matter what state you're in. I think many of you have probably already signed our petition for that, but if you haven't, I'm dropping the petition link here. But what we're asking you, if you could just share it on your socials, Facebook or X or Twitter. You can scan the QR code and it automatically gets it ready for you to share out. If you share it out and 5 people sign it, you've just now like quadrupled or so your outreach, and we can really utilize this as we're lobbying for this issue. We're going to be sending the petition out, text petition numbers out soon, and so the more we can advocate for this, the more we can see. Yeah, thank you for the signing and sharing. Love it so much. I'll drop those links to share it out in case you can't do the QR code. But that's all I got. Before you hit the end button, please make sure to share out these opportunities and sign the petition if you can. Perfect. Thank you guys. Thank you so much. Once you got that share and the send, please enjoy your Thursday evening. Bye.